it's Tyann with Lasting Change Therapy, and I am back for the fourth and last part of this postpartum OCD series, also known as Overcoming Intrusive Thoughts. The intrusive thoughts is the O part in OCD, where there's obsessions or thoughts that just come into your mind without you inviting them that are really disturbing. And I hope you do get to watch the first three parts because I think that will help you set up more success for this part as well. And today we're sharing all about exposure therapy. So I approach exposure therapy in three different ways, and I'll share them with you to just give you an idea about how I treat intrusive thoughts once we finish the first three treatment models that I've shared with you in the previous parts. And I want to give you some clarity, but want to give the disclaimer that it's important to do exposure therapy, likely with the help of a professional, because it can be a bit challenging doing it on your own to make sure that it is successful. Okay, so there's three ways that I approach exposure therapy, and the first way I approach it is through a here and now exposure. So for example, let's say my client gets an intrusive thought about, oh, my baby's gonna suffocate, or something bad is going to happen. Okay, so once they have this thought, my baby's going to suffocate, the first step that I have them engage in is something called just recognize and label. So you just recognize and you tell yourself, okay, this is an intrusive thought. And I know it's an intrusive thought because it's creating a lot of disturbance and anxiety for me. You see how that's really different from engaging in with the content, where they may say like, oh, this isn't going to happen, my baby's fine, my baby's safe, and they may even start to Google things and do specific things to try to protect their baby. And that actually engages with the content and starts to drive compulsions, and then actually has the intrusive thought stick harder. So instead of doing that, we do the first step, which is just recognize and label, this is an intrusive thought. A thought is just a thought. And I know this is an intrusive thought because it feels really disturbing and upsetting. The second step after you do recognize and label is allow and accept. And when we allow and accept, this is going to feel quite challenging, but you just allow the thoughts to be. You don't try to suppress it, push it away, reassure it. You just tell the thought, you can stay here as long as you want. This is just a thought. And you could even say things like, nothing is certain in life, so I might as well get used to it. And I know that feels really challenging and even scary to just allow the thoughts to be. But we see that they pass by a lot more quickly if we just allow and accept that intrusive thoughts are just going to come. Every single human being has had intrusive thoughts. And we just let the process pass by. It'll go by a lot more quickly than if we try to suppress it, distract from it, push it away, and do all of those other mental compulsions to fight it or get reassurance or get certainty from it. We may even try to disprove the fears by doing certain acts, either mental or physical. And again, it'll fuel the OCD and it'll lead the thoughts to stick harder. And so the allow and accept process feels really challenging and scary at first, but it's going to be a lot more effective in eventually letting the thoughts pass by naturally, because they always will. Okay? So you recognize and label, and then you accept and allow the thoughts to be, where you even have this kind of bring it on attitude. You can stay as long as you want. You can even do some positive reframing, like, I know this is your strange way of trying to protect my baby by giving me the worst case scenarios. So just stay as long as you want. And, nothing is certain in life, and I might as well get used to it. I had a client specifically had intrusive thoughts about either baby dying or that she will suddenly die and leave her baby. And so in her allow and accept step, she said something along the lines of, this is an intrusive thought. You can stay as long as you want. And nothing is certain in life. Everything comes with risk. And I'm choosing to move forward with life anyway, despite the risk. Because I want to live according to my values instead of living being dictated by fear. And so that's how she engaged in the allow and accept stage. And then the third step is where you just float and feel. So this is where you actually actively imagine disengaging from your body, almost like you're objectively observing yourself. And so when we're having intrusive thoughts, we will feel a lot of intense emotions, almost as if like that lion is about to eat your baby. And so you truly feel in danger. Your heart may race. You may start to have sweaty palms. You may even have tightness and tension in certain parts of your body. And so when you float and feel, you just imagine like you're floating outside of your body and just objectively observe and notice, oh, my heart is racing faster. I notice that I'm feeling tension in my neck. And so instead of fighting these symptoms, we actually just notice it objectively. And then that will also allow it to pass by faster. If we try to fight these symptoms and like rush to get rid of them, they'll actually stay around longer. So if you just float and feel, we know anxiety will eventually always pass if we don't continue to fight it. So the creator of my treatment approach is Dr. David Burns, and his analogy for this is once we actually face that monster, we'll realize that it has no teeth and it's not going to eat us up. But if we continue to run away from it, like using distraction, reassurance, etc., we will get away, but it'll continue to come back and continue to chase us. So instead of fighting your physical symptoms, you just notice it and you just let it be and you just float and feel. So allow yourself to feel the tension, and eventually it will pass by as well. According to the research, anxiety just can't be at that heightened level for too long if we just allow it to be. And they say in about 15 to 20 minutes, any form of panic or really heightened anxiety will eventually pass by. And then after that, we just let time pass. So that's the fourth step, where you literally just let time pass and even physically slow down. So a lot of times you're having this intrusive thought, you're feeling really scared, you want to run away from it. And what is more helpful is just to not be in that heightened movement, got to get away from it phase or response. And instead you just literally slow down, let time pass, just continue to move forward. And that's why the fifth step is proceed with life, where whatever you are planning on doing, continue to do it and continue to let time pass. And so I'll give you an example with a client, for example, who may have a thought that, the baby's going to be harmed by knives if she gets into the kitchen. And so she would then just has to take the baby and remove the baby to a different room, change her plans about dinner, even starts to hide knives or sharp objects. And so instead of engaging in those behaviors, we just proceed with life as if the thought had no meaning. So if I was planning to cook, I'm going to cook with the knives anyway. If I was holding my baby in the kitchen, we'll continue to go into the kitchen. I'll even literally slow down, let time pass. But really treat the thoughts as if they had no meaning. So just ask yourself, if these thoughts had no meaning, what would I do differently with my life? How would I had proceeded instead? I've had other clients who may have intrusive thoughts about, if I go for a walk, my baby's going to be kidnapped. And so I actually change plans. I'll cancel plans. I don't go for that walk. I even start to lock doors and check doors, check windows, and do all sorts of physical compulsions to make sure my baby is safe. And obviously this comes from a place of desperate love and desire to protect your child. And at the same time, if you remember from the previous videos, the compulsions is the fuel to the OCD. And so if we continue to engage in the thoughts as if they had meaning, it'll continue to fuel this intrusive thoughts process and the compulsions process. So the intrusive thoughts will stick harder, then we'll even do more compulsions. The more we do compulsions, the more intense the intrusive thoughts get, and then it creates that vicious cycle. Okay, so it's more important to treat the thoughts as if they had no meaning, even though it's going to feel really scary at first, and continue to proceed with life anyway, with whatever plans that you had, to go ahead and move forward with that. Okay, so that is the first form of exposure, which I call here and now exposure, on how to just deal with the thoughts as they come. And I got a lot of this content from the book called Overcoming Unwanted Intrusive Thoughts. And you can Google that on Amazon. I think it's a really good book and how it describes intrusive thoughts and these here and now steps on how to respond to them as they come up. Okay, the next level of exposure that I often will do with my clients is not just waiting for when the intrusive thoughts to come and respond, but you will actually move forward even harder with facing that monster by either engaging in cognitive exposure or in vivo exposure. So depending on the form of themes of intrusive thoughts that my clients have, I will do one or the other or both. Okay, so with cognitive exposure, it's usually things that we can't recreate. So like if I had a client who kept having thoughts that the baby's gonna die in the car seat, we'll forget the baby in the car seat. We can't really recreate that setting to do exposure therapy, so we'll do more of the cognitive exposure. And I know this again feels really terrifying and scary, but I'll have them do very specific steps with creating a script, so a cognitive script that they'll read twice a day. And the whole point is to let the body know that while these thoughts feel really terrifying, they're actually not truly dangerous. And the whole point is I'm gonna trigger the anxiety and not respond with compulsions. And then I'll retrain my body to know that I don't have to engage or respond to any of these contents in order to actually stay safe. So for example, she may, let me give a disclaimer, some of the intrusive thoughts content can be graphic, and so it can be triggering for you, but this has actually been the most effective way I've seen my clients be treated for intrusive thoughts. If we've walked through the first 3 models, which I've shared with you in the previous videos, and they're still experiencing some of these contents, I'll have them go through the script, and in the present tense, she may have contents like, you know, I call my husband, and then we realize that he did forget the baby in the car. He goes down to the car and the baby's gone, and I'm distraught. And of course, the first few times my clients will often just be very emotional. It feels terrifying because you are facing that monster and it feels really scary. And my analogy for my clients is we're doing exposure therapy is like us walking through the sewage pipe together. You're gonna want to feel gross and disgusting and smells terrible and feels horrible. And my job is actually to continue to push you through. And the more we push through it, the more we're going to move forward towards our goal of liberation for you through these just really frightening and terrifying, crippling experiences with the intrusive thoughts. And once we move through that sewage pipe, you're going to see that, oh, there's fresh air and it's going to feel a lot better. And on the other end, there's sunlight, you can take a shower, and you start to feel more liberated in life again. And so I know in the middle of this, it feels horrible and scary. And you may even have thoughts like, is this something that I'll actually want to do, or will it make things worse? It will make things worse if we start it and then you stop, and then that actually confirms that it is really dangerous. But if you start and you continue to go and move forward, then you will get to the other side and get liberation from a lot of your symptoms. And so I had a specific client recently just do the script over and over. And then by about the 3rd day, she started to see that the thoughts really had no meaning. They started to get less disturbing. She started to get less fear from them. The physical symptoms got better. And then ultimately just didn't feel like she needed to do many of the compulsions to feel safe around that anymore. Okay. All right, so that's cognitive exposure, where you cognitively expose yourself to the content and really work to let go of compulsions. And then you retrain your body to know that these thoughts actually have no meaning. I can face them and be okay. It feels uncomfortable, but it's actually not dangerous. And then I can really actually proceed with life and not engage in responding to the thoughts anymore. In vivo exposure would be like, what are the compulsions and responses that you're engaging in real life? And then it'll be important to let go of those typical environmental responses. And so let me just give you an example with that specific case. So if a client has intrusive thoughts about like the baby's going to be suffocated in the car seat or left in the car seat, she may actually continue to like check in with daycare, check in with husband, even come out in the car to make sure she didn't leave the baby there. And so it will be important to do in vivo exposure. When these thoughts come, we'll actually just continue to be at work and work on not engaging with checking in, getting photos from daycare, texting husband, and then ultimately just proceeding with life without engaging in those actual environmental compulsions. Okay. So if there's other themes, like a lot of times it's hard and uncomfortable for clients to talk about, but there may be themes that are like sexual themes that feels really inappropriate. Like I've had clients who may be even afraid that, oh my gosh, am I going to touch my baby in the wrong way when I'm bathing the baby or changing its diaper? And you may relate to this as well. It's really interesting how there's just really common themes. For example, like religious themes about the baby's soul being okay. There may be themes, sexual themes about touching them inappropriately. There may be harm themes of like stabbings, drownings, or someone coming in and kidnapping the baby. So it's obviously interesting how there's like a common link with like, I don't know, like the human DNA or evolution or something, where it's often these common themes, even though you've had totally different backgrounds and totally different experiences. And so the in vivo exposure for my clients, for example, if they're afraid that I'm going to change the baby, but I'll touch the baby wrong, and this is going to feel really scary for them, but I'll have clients who had started to avoid the baby. They'll just have partners change the babies by themselves, or just have mom come over. Someone else will always have to be there when they bathe the baby. And so you see how that actually gives more meaning to the thought than it actually is. And through all of the research, there has literally been zero correlation between intrusive thoughts and actual harm to the child. And so I actually never feel worried about the safety of the children. And I know that if we continue to allow the thoughts to be present and engaging in these avoidant behaviors, there actually may be more harm of like disconnect, mom feeling badly about herself, poor self-esteem about her ability to parent, and that disengagement can affect attachment more. So in vivo exposure for my clients would be, you'll actually force yourself to be the only person changing the baby's diaper, and even changing it multiple times in the day, allowing the intrusive thoughts to be there and proceeding with life anyway. And if you're avoiding the baby with bathing the baby, we will then have mom just bathe the baby alone. No one has to be there to watch her to make sure she doesn't drown the baby or harm the baby. I've had clients who won't touch their baby's skin to skin, because obviously like sexual abuse is the thing that they're most terrified of. It violates their values so much that they're terrified that something bad will happen to their child sexually. Their child's safety and well-being and mental health is so important to them that these intrusive thoughts come. And so what's important is that they stop those behaviors, like not doing the skin to skin. So actually wipe your baby, clean your baby with your hands. You don't have to use a towel to protect their skin to make sure you're not touching them inappropriately. While it's so painful to see so many of my clients struggle in this, it feels really hellish and like an imprisonment and a torture in these intrusive thoughts and fighting it. On the other side, and the liberation is just so powerful and rewarding to see that you really can heal from it. The intrusive thoughts do lessen. You can proceed with life and really live more often than not with a lot of freedom. And just knowing that even though intrusive thoughts for all of us will come and go, there's different ways to respond to them that will allow you to live again and feel like yourself again, and not feel like the fear is dictating your life anymore. Okay, so that wraps up our very last part of responding to intrusive thoughts, or how to overcome intrusive thoughts in postpartum OCD. I hope you do watch the first 3 parts, because the combination of the 4 is actually going to be the most effective way in treating intrusive thoughts in OCD. Just doing exposure alone is often not the way to go or the route to approach it. It's important to actually use the combination of all 4 treatment models. So thank you so much for tuning in. And then I guess I won't be connecting with you all next week, but I wish you all the best.